So here we are. We're going to do our mid-meeting recap and talk about spondyloarthritis. We're joined by John Reveille from Houston and Olga Petryna from New York. Welcome, folks.
Hi, thank you for having us tonight.
Yeah.
Yes, it's great to be here. And I've been over the whole program, and I share Eric's issues. I think there isn't a huge amount that's new to me that was being presented at this meeting. There's a lot of articles on treatment, and I think we're going to talk a bit about that. There's a couple of pulling back. There's some very interesting things being presented on the microbiome, but really pulling back. I think the most striking theme that's coming out with this meeting, whether we're talking about treatment, whether we're talking about disease manifestations, or even genetic profiling, is the role of gender and the gender disparities that we're going to see in it. And I think that's some of the stuff that I'd like to, I don't know if Leanne focused on that last night, but that is what really struck me the most in going over all these abstracts. Again, pulling way back and looking at the overall picture here. Probably, although there's not a lot new in that regard, nonetheless, one of the most compelling things that comes from this meeting.
Interesting. And I think it really helps, I think, better characterize patients, and the more we can characterize them, maybe the better we can treat them. Olga, maybe you should start by telling us something that you've seen so far in the first 2 days that really stood out for you.
Yeah, absolutely. And actually the matter of gender differences, that's something that stood out to me, and that's the abstracts that caught my attention, interestingly enough. So there are two abstracts that I really wanted to discuss, and they all pertain to gender differences. And the first one I will mention will seem like have nothing to do with it, but I will drag you into the woods of gender differences along the way. So the abstract 1303, which speaks initially about the prevalence of undiagnosed axial spondyloarthritis in patients with anterior uveitis and chronic back pain, starts out with the fact that a lot of patients have been referred to us from the ophthalmology clinic actually have symptoms of inflammatory back pain for a very long period of time. And interestingly enough, from most of the referrals who had recurrent arterial uveitis, 87% of the patients had inflammatory back pain way before they were referred to rheumatology. From those patients, about 53% or more than 53% of the patients meet the criteria for inflammatory lower back pain, and close to 30% of them had radiographic findings that could be consistent with axial spondyloarthritis. So as a result, about 23% of the patients were eventually diagnosed with axSpA as they met the clinical criteria. And about 40% in addition to that were requiring a follow-up with the suspicion of possible axSpA. And when we speak about this undiagnosed pool of patients, what stands out the most to me is the gender issue. So what happens is all the patients, female and male, have similar distribution of HLA-B27 positivity, duration of pain, severity of the disease, and you name it all. But when it comes to the actual diagnosis in these studies, 33% of the male patients were given a diagnosis of axSpA, and only 13% of the female patients were given the same diagnosis. So I'm wondering what's contributing to that. Is it the difference in the symptoms? Is it the difference in how patients relay their symptoms to their doctor? Or is there something phenotypically different about those patients?
Well, disease expression in women is with spondylitis has always been problematic and quizzical to me. John, what's your take on that?
Well, there's actually a lot of data being presented at these meetings, actually some from our group, but some from a number of other groups. And that is the strikingly higher prevalence of peripheral manifestations in women with non-radiographic and radiographic axial spondyloarthritis, including enthesitis, including peripheral arthritis. What's also striking, looking at some of the clinical trials, now there's only one that didn't show any difference between genders, but like there was one, for example, Maria McGray presented from Metropolitan Hospital in Cleveland with ixekizumab, as well as a number of others. that have shown that women respond less well to biologic therapy than do men. There's an abstract being presented, I believe, on Monday. This is the same group. This is Lee and Matt Brown. They're looking at a different cohort. They're looking at the Swiss cohort, looking at 850 people from that. And what they're trying to do is to use that genetic risk profiling score that they presented as a plenary session at ACR 2 years ago. This time they applied it to a different cohort, the Swiss cohort. And lo and behold, if you look at women versus men with radiographic axial SpA or ankylosing spondylitis, there were no differences in the genetic score. However, when they went to the non-radiographics, the men look with non-radiographic axial SpA look just like the men with radiographic axial SpA using this polygenic risk score. The women, however, look like the general population. So striking differences there, which I think is real problematic as we're trying to make a diagnosis, and it all the more underscores the gender disparity in this disease.
So we're about midway through the ACR meeting. John, you just touched on something that's coming up. That's not been presented as of yet. Olga, I know you have your schedule all planned out. What are you looking forward to tomorrow? And what are you looking forward to for the rest of the meeting in axial spondyloarthritis?
So I'm looking more, I'm expecting more data on, again, gender differences or baseline characteristics of the patients that are different that can actually help us predict how patients would respond to treatment based on not only gender, could be other characteristics. So that's something that's interesting to me. And like speaking of, again, differences between the patients, like this morning, the abstract was presented, the pooled data for executive studies. Again, talking about the gender difference at baseline, patients who were female more likely to have higher VASDI scores just based on the higher nocturnal pain, peripheral joint pain, and overall fatigue, while male patients tend to score higher on CRP and higher level of HLA-B27 positivity is observed there. So I think that where we start out is important, because if patients have different pattern of the disease or the picture of the disease, they may respond to treatments different. So I would be curious to see more abstract on the treatment outcomes pertaining to different patient characteristics.
John, what else you mentioned?
And well as the data here do show that women tend to respond less well, and that's clearly being seen in the current clinical trials.
Correct.
John, what are you looking forward to as far as reports or studies that may come out on Sunday or Monday?
You know, there wasn't really a lot on Sunday, but Monday is chock full of in the spondyloarthritis, especially in the poster session, with a lot of very interesting abstracts looking at different disease subsets like inflammatory bowel disease. Some interesting papers looking at the microbiome. One shows that the differences in the microbiome correspond to disease activity. Another one looking at calprotectin levels and showed that fecal calprotectin as a biomarker corresponds even in patients with AS with villus damage and blunting. So these are things that I think to me are very interesting as far as pathogenesis is concerned.
How about the meeting overall? How's it affected you? John, you're notorious for, being all over the meeting and meeting people and learning in your own style. How has this virtual thing affected you?
Well, it for better or for worse. It's a lot. Sometimes it's hard to connect to sessions. Sometimes the slides don't come regularly. But you and I really like about this is the ability to go back and review all the sessions. And so I'm going to predict that at the end of this meeting, I'm going to learn a lot more because I actually tend to get distracted by the networking. This way I'm having to focus on the science, and that's actually a pleasure.
Olga, what about you?
Well, what I like is the flexibility of it. And I must say, I like it a lot lately. So I can be anywhere and still attend the live session if I wanted to. And similarly, I can just postpone some abstracts and posters for later on, like knowing that they're pre-recorded. What I hate about this meeting is this lack of human communication. I really enjoyed meeting my colleagues and having a little chat or a cup of coffee and talk about things live. I think that's a big minus for the virtual meeting.
All right, folks, we'll wrap it up, and thank you for joining our group discussion. This was a lot of fun. We want to thank our audience for watching. Tune into Room Now for more videos, more stuff from ACR 2020. Thanks.
Thank you.
Thank
Thank
you.
everybody.